why daily painkiller use may be harming your health, and what holistic solutions Ayurveda offers instead.
Welcome to another episode of our podcast. So today's episode is about what painkillers can do to us on a daily basis and how Ayurveda can help us. So today's topic is extremely relevant for us. So all of us, for the slightest of pain, headache, backache, we try to take immediately a pain pill. So we need to ask Dr. Sandeep, what is his view in terms of Ayurveda regarding the intake of these medications?
Thank you, Dr. Parvathy. Yes, it's a growing concern. Many people think of painkillers as harmless, but using them often even daily can be risky. In Ayurveda, we consider pain as the body's signal that something is out of balance. But when we keep silencing that signal without addressing the cause, the root problem often gets worse.
So what exactly happens when you use painkillers for a long period of time?
Imagine you having a warning light on in your car instead of fixing the engine. You just cover the light. Painkillers are like that. They stop the message but not the problem. Over time, they can affect digestion, reduce your energy, disturb your sleep, and create toxicity in the body. I've seen people with regular body pain who ended up developing more complex issues like fatigue, acidity, or even anxiety, all linked to long-term painkiller use.
And what kind of patients do you see these kind of issues?
One common example is people with chronic headaches or joint pains. They come in saying that they can't function without a tablet every morning. But when we start looking at their lifestyle, skipping meals, irregular sleep, high stress, we find that the pain is actually just a symptom of a deeper imbalance.
And could you explain, Sandeep, how differently do you treat these kind of patients in Ayurveda?
First, we work on correcting the root cause. If digestion is weak, we help strengthening it. If stress is too high, we focus on calming the nervous system. For example, gentle oil massages, steam therapies, and herbal teas that calm the body can make a huge difference. We also guide them to eat lighter food, sleep on time, and also reduce the dependency on medication.
So what you're trying to explain is the focus is more on the long-term healing than the short, quick fixes.
Exactly. In Ayurveda, we don't chase symptoms, we help the body heal itself. When you give the body the right environment, rest, good food, mental peace, it often doesn't need painkillers at all.
So what about somebody who's very dependent on painkillers for a long period of time? How do you ask them to restart?
They should begin by observing their body. When does the pain increase? What triggers it? Then slowly introduce simple habits. Start the day with warm water, do a few stretches, take small breaks from screens, and get proper sleep. These steps may sound simple, but over time, they help reduce the intensity of pain naturally.
That's a very wonderful approach, Dr. Sandeep. It gave me such a good insight. And what is your final advice on this?
Don't be afraid of pain. Understand it. It's the body's way of telling you something needs attention. With a little patience and consistency, natural healing is possible.